Say this, the question I'm about to give you, we get usually more than one time a day. We get it a lot during the day. And here's what it is. Do I need anything more than Medicare Part A and B? Well, here's how I'm going to start. First of all, everybody's situation is different. But secondly, I'm going to tell you, don't just carry A and B by itself. Why? Because original Medicare is only Part A and Part B, and it only pays 80% of your Medicare cost or of approved services. So for example, if you go in the hospital under Part A and you get treated by all your physicians or MRIs or anything they do in the hospital, that's going to fall under B. And if you've ever received a hospital bill, you're paying 20% of that. How much is that going to be? I don't know. I have a client who had an $89,000 bill just for being treated for pneumonia. She didn't have any surgeries, but she had an x-ray and an MRI. And after getting all the antibiotics through an IV bag, she went home with an $89,000 bill. What's 20% of that? That's what I'm talking about. So those who have Medicare Part A and B only also need to select a Part D plan if they want prescription drug coverage. It doesn't come with the original Medicare. So here's what we're going to tell you. First of all, again, your situation is always going to be different than the person next door, your husband, your mother, your sister, even your physicians. Always talk with an agent because they're going to look non-biasedly at your situation. A and B is hospital and medical coverage only, leaving you 20%. How do you get that 20% covered? There's two options. You want to look at a Medicare supplement plan, or you want to look at a Medicare Advantage plan. If you don't understand the differences, that's okay. Most don't. That's why they download our guide. Call one of our agents. They'll explain the difference so you have an understanding. Third of all, Part D. If you're going to get Part D in an Advantage plan, make sure your prescriptions are in its formulary list of covered drugs. If you have a Medicare supplement, be sure that you elect Part D. If you don't take drugs now, which is common, people are healthier, but they elect a Part D plan later down the line, there's an enrollment penalty and it never goes away as long as you're covered. So my suggestion is don't stay with A and B by itself. Always get a secondary coverage. Secondly, talk with an agent. They're going to look non-biasedly at all the plans available to you. And most importantly, let me say that again, most importantly, you will not enroll at the wrong time, costing you a penalty if you make that call now. Now, hope you all have a great, wonderful, best day ever. Be sure to give us a call or like and comment and ask a question on Facebook.